Hi, my name is Amanda Rose, and today I'll be talking about HIV. I'll be going in depth about the pathophysiology, the symptomology, as well as the prognosis about this type of virus.
HIV. So, what is HIV? HIV is the human immune deficiency virus. It is a virus responsible for causing acquired immune deficiency syndrome, also known as AIDS. AIDS is a syndrome, as the name suggests, is a collection of various disease conditions that are related to the compromised immunity status individual as a result of infection with the virus. So, the pathophysiology of it. The pathogenesis of the virus is related to its invasion of T helper cells, specifically those that express CD4 markers. While there is a preference for fungal and viral opportunistic infections, along with the decline in cellular immunity, the occurrence of these infections can also be related to geographical patterns. As shown right here before in the image, is showing the T cell. And it goes over to show that the virus is entering the T cell. Then once the virus enters, it shows that the HIV copies itself inside the host and then it will start to destroy it. The symptomology. The clinical presentation of disease varies widely and correlates with the stage of the disease an opportunistic infection involves. An opportunistic infection, there are infections and infection-related cancers that occur more frequently or are more severe in people with weakened immune systems versus people with a healthy immune system. When the HIV virus enters the body, it takes 4 to 10 weeks for the patient to feel the primary infection. The primary infection is usually mistaken for the common cold or flu because it just has a fever, joint pains, skin rash, and sore throat. As said before, these are a few of the symptoms and signs that people will feel. Fever, the night sweat, sore throat, muscle pain, joint rash, fatigue. As said above, it says the most common ways the HIV virus may enter your body are through high-risk sexual behavior and exposure through injection or infusion. On the right corner is showing, according to the Centers for Disease Control and Prevention, more than 1.2 million people are currently HIV infected, and 12.8%, which is 1 in 8 people, are unaware that they have this infection. So who are the people at risk? Here it's showing African American men have the highest risk. They're 1 in 20. African American women are 1 in 48. Hispanic men is 1 in 48. Hispanic women, 1 in 227. White men, 1 in 132. White women, 1 in 880. Here's another chart showing the HIV care and as well showing the people diagnosed, receiving care, retained in care, and virally suppressed. Virally suppressed just means if these people were to be tested, it's not that they're cured, it's just not as highly detected. So here it shows people who inject drugs and showing you the chart of there's 94% of people who have it, the 62% who get the care, the 50 who are still receiving, and the 47 who are virally suppressed. The same with gay and bisexual men and heterosexuals. The diagnosis. HIV can be diagnosed through blood and saliva testing. Available tests include antigen antibody tests. These tests usually involving drawing blood from a vein. Antigens and substances of the HIV virus itself are usually detectable. A positive test in the blood within a few weeks or exposure to HIV. Antibodies are produced by your immune system. When it's exposed to HIV, it can take weeks or months for the antibodies to become detectable. The combination of antigen and antibody tests can take 2 to 6 weeks after exposure become positive. Down here shows the first in-home oral HIV test. As I said before, your first way you can be tested is rapid point of care. Is measured antigens and antibodies. Results are about 20 minutes. Your standard point of care measures antibodies. Results in 5 to 10 days. This is when they're drawing your blood. At-home test is probably like the other one, like the saliva one, is measuring antibodies. It results in 20 minutes to a day. The other one, your nucleic acid test, measures your HIV, RNA, and the results are in a few days. The prognosis. The drug dolutegravir has revolutionized the treatment of these patients with very effective viral load of suppression amounting to clinical improvement in patients. It slows the progress of HIV, but doesn't mean it's curing it. Another method people use to avoid HIV prevention is the use of PrEP. Your pre-exposure prophylaxis. It's used for people who are at high risk for contracting HIV. PrEP. It's a daily oral medication used to lower the chance of HIV. Two medications taken Truvada. I'm pretty sure a lot of you have seen this on TV. It's used for daily use of PrEP to lower a person's chance of contracting the virus from intercourse or injecting drug use. There's different stages of HIV. This is before HIV is affected. This is showing acute HIV infection, and it's showing that it's from week to month. You see the CD4 cells in the HIV. Then you see within years, the chronic HIV turns into AIDS. So the difference is acute HIV, it's the early stage of the infection. It develops within 2 to 4 weeks. The virus attacks and destroys your CD4 cells and your immune system. Then you have your chronic HIV, the second stage. It's also showing that the people could be asymptomatic during this stage. The HIV continues to multiply but at low levels versus how it is at the acute. Then it goes into your chronic HIV. Advances in over 10 years or longer. Through some people, advances faster. It just depends. Then it goes into your AIDS. AIDS is the final most severe stage. HIV has several damaged immune system, and the body can't fight off opportunist infections. People with HIV are diagnosed with AIDS if they have CD4 count less than 200. So AIDS people typically survive about 3 years without their treatment. This is just showing what happens inside the anatomy of the body. This is showing in your acute, you have your fever, your weight loss, your sores, you have the rash, vomiting, nausea, liver and spleen enlargement. Then it's just showing you have AIDS. Neurological, you have meningitis, your eyes, you have retinitis, your lungs, you have pneumocystis, pneumonia, tuberculosis, your tumors, things like that, gastrointestinal, you could have more tumors, chronic diarrhea. And now, spectrum of HIV complications is showing how this affects a lot of your different systems. You have your GI, your endocrine, your reproductive. It's showing all the different things it can affect.
We're in a space where, people are living, so HIV, you're not winning today. I learned about my HIV status when I was 16 at the Howard University. They had a health fair there, and 3 random people asked me did I ever take an HIV test, and I took one and discovered that I was HIV positive from that point on. And I remember my guardian, my mother died of AIDS complications. I remember my guardian telling me, don't tell anybody, keep it a secret, it could be our secret. And I just had this epiphany, like, no, this is the reason why I'm finding out 16 years later, because we kept it a secret for far too long. The physical concerns that I had pretty much was definitely around death. I remember just really thinking about who was going to get what when I died. My brother was going to get stuffed animals. Destiny's Child was going to sing at the funeral. And it was just, I really just had this wild imagination in terms of what everything would be like. But then I kind of stopped it because I was like, I'm not going anywhere anytime soon after I did more research. I mean, at 16, when I first learned of it, I didn't know how long I should be able to wait without taking medication, so I just wanted to follow the recommendations of taking it now, which seems to be the message now, like start treatment earlier. The advice I would give someone who's newly diagnosed with HIV, I definitely would say start treatment as soon as you can, because I think once your body gets to lower levels, it's really kind of hard to bring it back up. In terms of inflammation, we definitely want to make sure that you are taking care of your viral load and the amount of HIV in your system before it gets, out of hand. I definitely understand the fear. I mean, I definitely have gone through it. I understand it pretty well. I also understand it from a standpoint of being off of treatment for a number of years and kind of like playing with the medications, so to speak, kind of like taking it. I'll take it 5 days a week, but I won't take it on a weekend. Kind of playing with it that way, and that was basically off my own ignorance and not really understanding that these medications are keeping me alive and keeping me well. It's so many tiers to living well, not only just physically, but you also have to have great emotional health. Who can you cry to? Who can you just let your guard down with? As far as the mental health, who can you talk to about the struggles you have with HIV? You are alive, and because you are alive, you still have time, you still have the power to do what you still want to do. And I think that when people hear those words that you're positive, I think they just feel like they just give up hope. And I think that is if anything, that should inspire you to do more. What more can I do with my life? How can I live my best life? HIV treatment works. Get in care, stay in care, live well.